really the framework for our research enterprise. And then Joe's going to take over with an illustrative example related to activity space. And before I move forward, I just wanted to give a shout out to Francesca, who's really the third author in all of this and has helped us really mount Core D and make sure it all came together. I also wanted to introduce David Meltzer, who is the PI of our center at the University of Chicago, and Kelsey Bogue. And David, Kelsey, and I really wrote much of that proposal together. So wanted to acknowledge the both of them. If you want to say hello.
Hello.
Everyone.
And I will say, David has many talents, which I could go on about, but a key one is that he is very clever with the acronyms. And so our study, CHABLIS, which I will describe in detail, our center was David's clever label. So I just had to give you credit for that.
Thanks, Kate.
Sure. Okay, Joe, next slide.
Hang on, sorry.
Yep, that's great. Great, so as I noted, our clever acronym from the University of Chicago Center for Healthy Aging Behaviors and Longitudinal Investigations, and the Center for Population Health and Aging. And there are a few things I want to say about this collaboration. You know, NIA really wanted the connection between our centers, and that was really part of the RFA, but it wasn't completely clear how to navigate that. How do you think about constructing a core that is truly joined? And so one of the things I think I am most proud of through this process is that we were able to really create something that was more than the sum of its parts, something that came together, I think, substantively and operationally, that brought together the strengths of Duke and the strengths of the University of Chicago to think about research on social surveys and aging populations in a new and innovative manner. Next slide. So these are the investigators and the entire staff who've been involved in this enterprise. So many of us, of course, the two of us, but along with Bill Copeland, Scott Hutel, Rick Coyle, who's also here. Hi, Rick. From the University of Chicago, Dan Black, David Meltzer, Cullum Mercatek, Seth Sanders, sort of via the University of Chicago. Seth was trained at the U of C. He's part of our sub-award, and Linda Waite. Again, from Duke, Francesca Flory, Wanda Burns, Sarah Koitek. Sarah is here today with us too, and Stephen Smith and Kevin Brown from NORC, so connected to the University of Chicago. And I also want to give Joe credit for coming up with a really nice slide design today, so that you can easily identify the University of Chicago and Duke parts by our identifying colors. So next slide. So these are our three key aims for Core D. It's really to think about how to design data collection and measurement innovations. And we refer to these as rapid assessments. That becomes critical to the way we're thinking about the sharing of information and our findings. And these are for existing population and hospital clinical-based studies of aging. Our second key aim is to conduct these rapid assessments, either on existing studies within CPHA or CHABLIS, or on test samples that actually mimic those studies. And to finally disseminate and educate the field on successes and shortcomings of rapid assessments conducted by this collaborative. And, I think one of the things I really want to emphasize here is that I think what many investigators have found, and those of us particularly related to social survey engagement, is that communication among large-scale social surveys we think could be enhanced. And there are ways in which we're all trying to develop new sorts of methods, but how effectively are we sharing them? And I think we recognize that publication processes can often be too long to effectively draw on the insights of one another, and that there is a bit of a lag, right, in terms of when that information is shared and then when it can be introduced in the field. And we feel, committed to modernizing social surveys, but recognize we need to be nimble in terms of instrumentation and field structure. And so we really wanted to find a way to, engage in these rapid assessments, write them up quickly, and then come up with lots of interesting ways to disseminate that information. And with that, Joe, I wanted to just invite you to jump in and see if you wanted to say anything else about our broad approach or how we came together to develop this core.
Well, just, quickly, Kate and I have known each other for a long time. But we've had this discussion about sort of these issues for a number of years. I don't think they were cranky, but they were what could you, sort of, there was an element of things aren't getting done in large scale studies, which, have a challenge, funding, et cetera. Each of us have been involved in one that's reasonably large scale. Kate's now in a much larger scale. And we decided this was a strategy that, when the renewal of the P30 Center competition within NIA and the branch for social and behavioral sciences, right, that this was a good opportunity to try to see if we could actually pull this off. And that's we're fortunate enough that the review panel was willing to fund us. But as you're going to see, right, we have some ideas and we're going to put them to the test.
Yeah, and I will say too, this is sort of a side point, but I want to share, I think this is really, this project and the way it is unfolded has really been sort of a highlight of the last few years. I really like this material. It's been so centered, it's been so fun to engage in these conversations with Joe and to think about where we saw the field going, but to see the project unfold in the way that it has and that it's incorporated all of these additional studies, including the Great Smoky Mountains Study and RAISE, which we'll talk about in a moment. So let me give you a little more background and context. So advances and challenges in data collection measurement, many of us know what these are, but we have to think about collection of biospecimens, measuring particular health conditions. How do we collect them? How do we store them? Are there possibilities? We can share maybe more in a Q&A about a biobox that the NSHAP study has developed, which is sending out particular kinds of self-assessed measures for our respondents and thinking about ways that those could be incorporated. We're adding administrative and electronic health records, adding contextual data and the use of mobile technologies. And that becomes central to what we'll talk about for most of our time together today. And what are some of these key challenges? So respondent and subject concerns about confidentiality of their data, particularly if you're tracking them with a smartphone, you could imagine that people might have some concerns. Declining response rate, challenges to maintaining population representativeness. Certainly from the mobile technology standpoint, do people feel comfortable using the phone? Are they familiar? And this becomes, particularly salient at this stage of the life course. Joe, do you want to add anything there?
Nope.
Okay. Next slide. So these are the existing studies that are represented in our collaborative pursuit. And what's really nice is to learn about what I think both of these institutions have been engaged in. So first, activity-based social interaction, health trajectories in later life. That's something it's actually, I'm coming to the end of that study at end of our 5-year period, but that actually has helped, and Joe will talk a little bit about this, but it has helped provide a frame, at least for how one uses mobile technology synced with ecological momentary assessment to think about the circumference of turf for older adults in an urban context. And so this comparative piece becomes important later. I mentioned the biobox that the National Social Life Health and Aging Project has been using and possibilities of drawing on that. I will describe briefly the hospitalist project, in which David is the PI, and thinking about ways that we can draw on those administrative records. And a project related to NSHAP that Seth Sanders and Linda Wade are doing together to think about response time data. So basically using keystrokes, trying to understand whether keystrokes are informative for the way we understand cognition and cognitive impairment. Then we have a number of studies that, from Duke and colleagues there, the Ad Health Parent Study, the Murdoch Study, Consenting Project, Measuring Stress, Wellbeing, Connectedness Among Generations that Joe has worked on with Candace Odgers and others, Mechanisms Regulating Complex Social Behavior, Rick Hutel, and I'm going to talk about how he's involved in this project in a moment. Project RAISE, I mentioned that Rick is with us today, and we're going to talk about that study in more detail because of where we're drawing the data, and then the Great Smoky Mountains Study, and then Joe and I with Bill Copeland recently got the rural aging component of the Great Smoky Mountains Study funded, and it will incorporate in part these new approaches to thinking about data collection in rural context. Joe, do you want to say anything about GSMS or the other Duke projects?
No, you know, but it turns out, you know, you can, there's always going to be a feature of, you know, we don't cover the waterfront in terms of these studies, but what's been important is they gave rise to problems, right? We didn't sit around and dream these up. Right. They were problems that we, you know, encountered in each of our studies. And, you know, that was the distinct feature when we came together. We kind of, you know, and started discussing this, we realized, man, some of them are common, some are unique, but these are real data collection problems as opposed to, you know, sort of in the abstract. And I think that keeps us grounded in really important ways. And you'll see that in the kind of the other ways we thought about how we want to prioritize and principles we want to follow.
Yeah, and I think that's a terrific point. It's also nice to think about how it's nice to see in real time how some of the work we're doing in Core D could actually influence some of these larger scale studies. And so I think that's provided a lot of steam for our larger research group. So what are our guiding principles? So when we think about these rapid assessments, we want innovations targeted for studies of aging, especially those that focus on social and behavioral determinants. We want to think about the key questions that, you know, is this scalable? Is it adaptable? And, you know, and an important piece that we're all thinking about all the time, is it cost effective? Can we really actually implement this kind of assessment? Innovations assessed in existing studies of aging or with test samples with an eye toward, again, applicability to in-field population-based studies. So we know, for instance, some of these things can work in a more controlled environment. Can it play out in a large-scale social survey? So our, you know, and our goal too is to note that these assessments will not be resource intensive, and the assessments will be completed quickly. And so this gets back to that issue of publication and sort of the lag effect in there, and wanting to make sure that people are well aware of the science we're engaged in, and we share what we hope is good news. We share it quickly. But even if it's bad news, right, we want to make sure whatever we learn from these sorts of assessments that we're informing the field more rapidly. And Francesca's come up with lots of different sorts of ways to think about sharing that information so that we're not, let's say, relying on what are traditional academic pathways, but thinking in a more contemporary fashion about social media and other sorts of mechanisms. And we'll describe some of those later for making certain that, that people are learning about the work we're doing. Next slide. So one of the things we want to do is prioritize the use of mobile and new technologies in data collection, assess issues of sample recruitment, respondent and subject consenting. That's become so critical recently. Disseminate our findings. I've really kind of underscored this quickly and widely to a broad-based research community. And I haven't mentioned this piece yet, but we're really particularly interested in next generation scholars. And we actually, as an exercise of our larger research group, we put together a focus group of postdocs and early career investigators to help us think through, you know, where do they turn when they seek information on new research methods? And so how can we make sure we're a presence in the various platforms they draw from? So again, you know, we want to make sure that we're engaged in training. We're hoping to do a summer institute this summer, and that I'll just leave there, right? That by then I hope we'll be without masks and able to travel. Next slide. So right now I'm going to describe the three rapid assessments that we laid out in the proposal. And the last one relates to activity space and its applicability in spaces outside of rural context. But I'm going to mention the first two, which are in various stages right now. So the number one, bringing lab-based neuroscience measurement to social science surveys. So this is to assess the feasibility using lab-based measures of cognitive processing and decision-making to field studies. Just thinking about response time, eye tracking, mouse tracking, other kinds of ways that we can infer, right, what a respondent might be thinking based on how they engage with technology. Seth Sanders has provided one example to me by, you know, presenting a respondent with a list of their kids, for instance, and then asking which kid they might rely on for financial reasons, for social support reasons, and then looking at how long that respondent looks at the name of that particular kid who was nominated in the list. So that's just one quick example. All of these have been used in a lab setting, more controlled setting, to measure cognitive functioning and processing, but we want to see how that would work in the field. So we've all gathered together to bring this to fruition. And Joe, do you want to say anything about
Yeah, so I would just make one point, right? You know, the lab, you know, this is a kind of, the resources matter here in this particular case. The settings that use of, for example, eye tracking, especially, response time's a little easier, right? Really require, you know, additional equipment. They require, you know, equipment that's extraordinarily sensitive. And the question is, can you move that out into the field? You know, your iPhone or your camera on your computer is not going to be enough. But the question is, you know, can we get it, you know, as technology improves, and it's proving dramatically in this particular area, we sort of actually start to see that we could implement this. So the idea of this project is to, let's try it out. Let's try to set up a design in which we compare the two, you know, in lab with methods which are done in a quote survey setting. This will be done in Scott Hutel's lab and here at Duke for the lab part of this, and we'll find out whether it works. I mean, you know, the question may be that it's too early. We're not there yet with respect to the technology, but reliability, and that's going to really be assessed, you know, sort of repeated, you know, measures of these. We'll do this in, you know, a couple of different contexts, the decision-making context and other contexts. The example that Kate gave is another way to do this, but you know, oftentimes these are done in like financial decisions or other types of settings. So this is one that we're underway. We're starting, you know, working on the design and, you know, or trying to zero in on what are the equipment options that you could do this in the field.
Mm-hmm. Great, thank you, Joe. Our second is assessing alternative strategies for consenting for administrative data linkages. And so this is thinking about Medicare, Social Security earnings, electronic health records as key sources of data for a wide range of studies on aging. So these are often linked to population community-based studies, but such linking usually requires informed consent, and failure to obtain it can complicate coverage and certainly affect representativeness in these studies. So we wanted to do a rapid assessment that sample participants in David's Hospitalist project, assess alternative ways of obtaining consent based on predictive models of willingness to consent. And that's drawing on findings in the Murdoch study of consent. And David, I don't know if you want to say a few words about how this would play in with the Hospitalist project or what you think we might learn.
Well, I mean, I could talk in general. This is a very large scale study where we consent prior to COVID, about 7,000 or 8,000 patients a year. We interview patients when they come in the hospital, and a month after discharge. A lot of the work is done by students. We have a tremendous labor force, but as large as the labor force is, we can't get to everyone. And so it is an interesting question whether we can, predict who's likely to consent and also allocate our effort in ways that's going to be more valuable. One of the really interesting problems in this is that sometimes some of the most interesting people to consent are some of the most difficult to consent. And so, we're not just trying to maximize the consent rate or number of consents, but to allocate our labor in ways that would lead to the most meaningful sample. So one of the interesting questions is whether we could do some predictions, of not just whether people consent, but who are the people likely to consent in various strata, and think about whether we could then use that strategy to allocate labor towards getting a richer sample in the people who are going to be most valuable. But it's large scale activity, and we have so much data that could be used for prediction because we have electronic health record data, we have notes, we can do a lot of that even in real time. So I hope that helps.
And let me just thank you, David. Yeah. What's exciting about this is I was involved in a study with one of my postdocs, right, on trying to figure out consenting for the Murdoch study, which is a study at Duke, because they were having difficulty of getting consent, getting people to agree to participate in their community-based study in North Carolina. And one of the things that we kind of worked on was trying in a different setting to ask, what do people care about? What is it that the limits their willingness to consent? Is it confidentiality? Is it issues about they don't agree with the study, they may have reservations, they're just a lot of different sources, and we explored some of that. The data that David's talking about allows us to basically, you can think of this if you're a machine learning type, to basically use a lot of data to try to assess what are the barriers and what are ways that people are responding to these barriers. For example, we had this really interesting thing, found out that people who had identity fraud, they purchased identity fraud insurance, or more importantly, were knowledgeable about that, turned out to have much greater willingness to provide information about stuff that is not covered by that form of insurance at all, right? But it's presumably partly about a knowledge. That's the idea we'd like to build on to figure out who's willing to consent and what matters to them, because one can think about adaptive consenting, providing people with information about what it is they care about, and predicting what that is sort of at the central, central to be able to pull this off. So it's an ambitious project, but the database that the hospitals project provides, right, is kind of unique.
Yeah,
really
actually, can I provide an update from the field of something that's kind of in the realm of the mundane, but sobering and interesting? So we're recruiting for a bunch of other studies simultaneously that are in ambulatory patients. And after a long hassle, I finally got approval to basically set up a table in the lobby of our hospital. And it's actually been really successful. We've gotten way more patients that way than we had gotten in a whole bunch of other ways that we had tried. And I'm now fighting with the fire marshal to make sure that I can continue to do this. But there were some other people doing recruiting as well, and they were giving away shiny objects. And my research coordinators were telling me that the shiny objects seemed to be attractive to people. So we were thinking like what we would give away, and one of my colleagues had some extra Halloween candy. And that was actually seemed like it was useful, but we felt pretty bad about it. Because these are medical patients. So we thought about something healthier and came on bananas. One of these is an oral health study, so you can't really give away apples because that just makes people feel bad. But bananas are are attractive, and they're actually very cheap. So rough estimate, somewhere between 2 and 4 time increase in recruitment rates just by giving out bananas.
I can't top that.
Yeah. So, I think the thing is, like, we're all attracted to like machine learning and deep social science theory. But the other side of this is that there are these kind of really mundane things that actually sometimes really make a difference. And it's all so contextual. Anyway, we'll see how many of these people actually stay in, and, a bunch of other things. But I think it's a reminder, in good policy analysis, right? You're considering all your options. And we do have a range of other options, from financial incentives to bananas. And like, I am unendingly amazed by what a doctor will do for a donut.
Good to know. Yeah.
Yeah.
That could be your 4th rapid assessment, David.
Yeah.
Yeah.
The banana assessment. Yeah.
Yeah.
But for right now, I'll talk about our 3rd one, and that's examining daily activity space in rural and non-rural settings, feasibility study. So this is the one that we're going to spend more time. We're going to show you some data that Sarah, Rick, Joe, and I, Bill, all sort of have, and Francesca have been pulling together, analyzing, discussing for these last several months. Rapid assessment of the feasibility of examining the daily activity spaces of individuals and measures of their overall well-being in rural and non-rural settings. So, I just wanted to say quickly, almost all the studies activity space have been in urban environments. And I mentioned the one earlier we have in the city of Chicago. The origin of activity space research, which I could go on about at some length, but I do want to share quickly that one of the reasons I find it so compelling is that there's this really wonderful tradition of neighborhood-based research that comes from the Chicago School of Sociology at the turn of last century, thinking about how communities form and function, principles like social cohesion and informal social control that create connectedness and community. But so much of that is based on residential location, and residential location is the anchor for what it is described in contemporary elaborations as neighborhood effects research. So I think after, having spent a decade or so thinking through those questions, one is struck by the fact that, of course, there are lots of other spaces that are relevant in people's lives, and that people are spending time in many different locations with many different social groups, and that those are also influential. For instance, for one's health and well-being, which is a central feature of the research we're engaged in. And so really wanted to gain a better appreciation of one's circumference of turf in daily life. So one can ask questions, for instance, like, is one's social circumstance throughout the day as segregated as one's neighborhood? You can ask questions about whether, the spaces that one inhabits during the day, are they more or less riskier, depending, right, on time of day? There's so many ways that activity-based methods and concepts, I think, expand our view of the contextual aspects that influence people's lives. And so we really wanted to be able to dig into that. One of the things that helps us do that is ecological momentary assessment. So for instance, when we're following you with your phone throughout the course of a day at random intervals, we will ping you and ask a short set of questions about who you're with, how you're feeling, what's the circumstance in which you are maneuvering in that moment. And so to be able to situate people's emotional context and their setting geographically is a key contribution of this form of work. Joe, I don't know if you wanted to say anything else about activity space.
No, you're the expert.
No. Well, I'm working on it each day, hoping to learn more. So an important question is how these activity spaces and momentary well-being differ in rural and non-rural environments. And so we haven't seen a study like that yet. And one key question is it feasible? Can we conduct comparable, studies in rural environments using the same protocols? And can one conduct these studies with individuals' own mobile devices? I'll say in our Chicago-based study, we actually, in the pre-COVID period, we had interviewers go out to the house and they would do blood draws, other things, and hand people a phone. We actually had a separate wave during COVID, and we mailed people the phones that they would use. But because of the age of our cohort and the distribution listed toward those of low income, owning a cell phone was not as common as it is, right, in younger cohorts. And we also want to keep the platform consistent, other reasons for that. But we wanted to ask, will compliance to these intensive protocols, so EMA 3 times a day for 7 days straight, and hopefully, Joe, you'll chime in your own thinking about how we can relax some of these ways that we approach EMA and thinking about them to capture dynamics that might shift over the course of a year, for instance. But, we want to, how are people feeling about continuous monitoring? And will that be the same? And can you conduct a study, for instance, during the pandemic, following these no physical contact protocols? And that was one of the reasons we, within our kind of core D decision-making, we started with this project first, because we really knew that we could do this without any kind of in-person contact. So that's why we undertook this rapid assessment.
To just say a little bit more about this, right? I
Absolutely.
mean, part of the and I'll go on and sort of give you more depth about the study and what we found so far. But the key part of this whole thing was we planned this, we submitted the proposal, we waited and got, we got it funded, and the funding came through, and, then COVID hit and a lot of stuff was stopped. And we weren't sure about this study when we started, because in past, right, much of this has been with at least one of the studies one of the samples that we used, or the studies data from the samples that we used, was one in which most of the contact with individuals, the subjects in the study, the respondents were in person. So this took a bit of, assessments to sort of see whether or not we thought this was going to be able to work. Could we basically go through the procedures of doing this? And that's one of the things that led to, well, it would really be convenient if we didn't have to rely on sending out and getting back, phones, which we had provided to them for the particular study. And so the long story short, the COVID, while is a challenge for all of us, did introduce some new but interesting and useful
Right.
Again, I'm not suggesting that COVID is a useful thing, but variants that we had to deal with that were, I think, helped push us along to deal with, a more efficient, cost-effective way of conducting the study. So what I want to do now is sort of take on, I'll tell you a little bit about the design of this, and then tell you what we found so far. We're still very much in the process of looking at the data, but we have an idea of at least the broad parameters of, could we pull this off? So let me tell you a little bit about the design. We stressed earlier in the slides, we really wanted to keep this in a framework in which we were using existing studies. That sort of, as I said, grounded us. It made it real, made it deal with the situation. So we had been in discussions, and as Kate has indicated, with Bill Copeland, we have ended up extending the Great Smoky Mountains Study, but that became one of the first ones. And the useful thing was they had just been in the field. In fact, they have a nice, really interesting before and after the pandemic, because they happened to be not completely finished when the pandemic hit. They had to pull out the field operations, but they had been in the field and they made recent contacts. They had recent contact information for individuals. This is a study done in Western North Carolina, as indicated here, including an Indian, members of the Eastern Band of Cherokee Nation. This is a study that's been going on for a while. So there, in this particular case, this is a study in which we thought, while you want to try this out in different environments, you don't want to, you want to try it out where one which you think you have some, chance of success. And the long involvement of the sample members in this study since over this period, they started when they were adolescents, right, was a particularly attractive feature. The rurality was crucial because it had enough rural components to the sample that it could allow us to sort of really see how this is going to work. If those of you haven't been to Western North Carolina, it's this is the Great Smoky Mountains. There's mountainous, and one of the real questions we had was, were we going to be able to pull this off reliably, especially with the activity space monitoring, right, which really is sort of real time. And really puts a strain on having cellular coverage to be able to gain access. The second study, which we kind of had not initially planned and not initially thought about, but Rick Hoyle, through conversations with Bill Copeland and then Kate and I, sort of has an ongoing study of adolescence as it started out, right, with the study of self-regulation in families across North Carolina, including some overlap for the areas where the GSMS was held, but other parts, including more urban parts of North Carolina. One of the things we realized was, while Kate's study was a urban context, we really wanted to be sort of more, be able to do this in a similar time. Pandemic really required that, to be able to actually conduct a part of this study which was done in a urban area, so we could directly do the comparison between the two. And Rick and Bill had worked together on these projects before, and Rick's center, right, the C-STAR Center funded by NIDA, right, provided us with this opportunity, and again, met this criteria that 2 ongoing studies, they have a field operation, and we're able to sort of do this with 2 different studies. That presents some interesting challenges, and I'll sort of talk about that in a second. So what we did was to draw samples from each of these. So there was a selection for a random sample from the GSMS. We decided to concentrate the GSMS on this Native American sample from the Cherokee Nation tribe. And we drew samples from that group. That group, the GSMS sample, is in their 30s and 40s, right? And so we were going to use the existing staff that was there. As I indicated before, they were recently in the field. Rays has a different age range, right? And so we basically decided, well, let's try to limit the sample that we draw from the Rays sample to meet the 2 criteria. Number one, the age range was met here. And secondly, we wanted to sort of draw purposefully with different clusters from urban, rural, and, as you see here, suburban areas. I'm going to say more about that in a couple of slides, but as it turned out, in both of these cases, we were dealing with different staffs, right? Came together to collaborate really well. And so we had a lot of discussions about sort of commonness, but these are different projects, right? And that presented just another real challenge, but a useful challenge in terms of understanding how well we could pull this off. We asked subjects to use their own cell phones or smartphones, as I just indicated before. That's part of the conditioning. That affected a bit. There were people who didn't, but and we're going to have to do more into sort of analysis of what selectivity did that involve in terms of not having a smartphone. But our initial sense is that wasn't a great source of non-compliance. But a key one was they had to agree to put this software, a tracking software. The product is MetricWire. We'll say more about it in a second, right? Had to have it installed in their phones. And we had to do all of this, right? Not having sort of any kind of physical contact, right? This all had to be handled through communication by email and more likely by cell phone discussions. So all of this feature was recruiting these two samples, but then dealing with the reality that we want to make it as comparable as we can across those two different studies. And that was a key part of the design. And then we asked them to participate in the study. This was a more classical EMA study in the sense that EMA studies tend to be in this period of some consecutive days for a week, maybe longer. You're asking people frequently during the day, and you're doing really short surveys in this environment now on their cell phones, morning, afternoons, and evenings, pinging them with questions about their affect, their mood, what they were behavior they're engaged in that would help us link to which we're going to be able to do the data that we were getting on tracking their movements during the same 7-day period. Then on day 8, right, we would have them. On day 8, we would do this kind of post survey, right, closeout survey, where we asked them a lot of questions about, did they encounter problems during the week this was a longer survey that we did at the end to try to find out, how did they feel comfortable with the study? Did they, what was their experience from that? So we gained a lot of information. The software I mentioned before is MetricWire. It's a study. We were influenced by this because this is the software that the Chicago activity space study that Kate just described a few minutes ago was describing. So we wanted to be, again, grounded in an existing study, and the software, and in this particular case, the tracking software that they use. MetricWire also form in one package, right, in one app, right, could also handle the EMA. So one of the attractive features is it could do both. You could split these tasks apart, and in the report that we're writing, we talk a bit about those options. We do a design phase to deal with some of the issues that I've already talked about and to come up with solutions and identify strategies for doing this, and engage the field staff, members of the field staff on how to sort of pull this off. And then we actually in the field for 16 weeks. Interestingly, you're going to see in the next slide, right, we did 2 different things in this study, and that reflected the sort of what each of these studies wanted to be able to do. So in particular, before I get to that, sorry, one thing. So we provided compensation. So a key part of this study was what our compensation was, and we broke that into the component parts, right? So as you can see here, individuals in this study could make up up to $135, which is a sizable amount and a rather generous but incentive, but it reflected the different activities, and we broke it down in ways so we would pay them on the basis of the surveys these daily surveys 3 times a day, 7 days for a period of 7 days, relatively small amount. We gave them a bonus if they completed 15 or more, because we really wanted continuity and coverage over the study, and we were trying to preempt. And you're going to see some results about this. People going a couple of days and saying, "I don't want to do this anymore," right? So we try to incentivize that. There was an economist in the group. And we provided, payment for this final survey. So this is the payment possibilities for this particular study. So what I want to do now is sort of tell you about what we've found so far. There's more work to be done. Stay tuned, and we're going to, remember one of our missions here is to communicate with other groups to a wide audience. But here's what we've found. The first thing I want to talk about is this distribution of the sample. Now I always forget, it's rural, urban, I always forget what the CC codes are. I'm going to call it RUCC codes, right? Or this distinction of different densities of counties in which people reside, right? By their population densities. This is done in conjunction with the U.S. Census Bureau and sort of the data coming from those. And you can see lower numbers here are more dense urban areas. So the upper part of this distribution is so-called urban areas, and the bottom part are representing more rural. And sort of in the middle of that really is a classification that's probably one would call suburban. But we started out with and made the decision that we would concentrate GSMS on people residing in a rural area, in particular Native Americans residing in a rural area. And we drew a sample and we had a fixed number of people that we were targeting. We were targeting getting 20 samples. I'll show you what it took to get to that level in just a second. So they're only rural areas. We don't have the designations right now, but we'll pick this up, exactly where they came, but by classification. The use of the raised sample, as I said before, was always intended to sort of be able to give us a urban part of this, and we decided we should just, within the study for comparability, right? We'll distribute them over the entire range, or at least initially we drew an urban-rural part. So the recruitment went pretty well, right? It was to Rick's credit and Sarah's great job in the field operation, we decided to move on and actually keep recruiting people. So as you can see here, we added the suburban sample kind of in the middle. Initially, we were just picking off, the top three and the bottom three in this classification system to get quote really urban and really rural. And we decided to put, more sample in the middle. And you can see we ended up with 162 observations from the RAISE study. So taken together, we've got a pretty good sized sample, obviously across two different studies. So you have to be careful about the comparability, but you're going to see there's a fair amount of comparability that we can that we achieved in terms of, at least based on the results we have. Kate.
Joe? Yeah, I was just going to jump in on one thing to say, even though this isn't sort of central to the way we were thinking about the structure of our sample, one of the things we did in the brief questionnaire was to ask people how they characterized their location, where they lived. And we think this is a wholly separate research pathway, and certainly at least a paper. But many people would characterize themselves as rural, even though in this coding scheme they would fall out in suburban context. And I'm trying to think if there was an example where even they would fall out in an urban context. But we did get that, right? So the discordance between how people identify as rural or urban and where they live, I find that fascinating.
Yeah.
Kate, can I just add?
Please.
So my master's thesis in sociology from the University of Arkansas is directly on that topic.
Really?
We did a study of Washington and Benton counties in Northwest Arkansas, and both of them were undergoing rapid change. That's at the time, this is the home of the University of Arkansas and Walmart, Tyson Chicken, etc. So that whole area has been exploding. And one of the questions we asked people in the survey was how they would they consider the area they live in to be rural or urban? And what my thesis was about was the fact that the stronger they had, the sense of community that they felt, the more likely they were to say the area was rural. So it kind of ties back into Gemeinschaft and Gesellschaft and what people think about urban versus rural areas. Anyway, if I can find it,
do.
Please send it.
I'll share it with you.
Oh, I would love to read that, because this is definitely a pathway I think we're all, as a research team, interested in exploring further.
So let me tell you a little bit about the recruitment process. this breakdown is going to give you what we started with in terms of the target sample that we drew from the race study, from the GSMS study, and then essentially looked at the question of, how many were willing to, did we get a consent from, right? Consenting happened a little bit differently across the studies, more use of, sort of by use of technology versus, different strategies of the way they were contacted through email addresses, through, essentially text messages, et cetera. So there's a bit of a difference across these studies. So most of this I'll break out separately by RAISE and GSMS, but here's the kind of message. Then the second part of this is, in the process of determining, especially for the primarily for the RAISE sample, and only, I guess, exclusively in the RAISE sample, eligibility, remember, was determined by what their ages were, and we don't know that exactly until you get into asking them this questions about their, sort of their age, and this issue about cell phone. Do you have a smartphone that's capable of doing this? My dear late mother-in-law had a flip phone, and she always thought she had a smartphone, and we decided not to dissuade her from that, dissuade her from that view.
Right.
But so, there were reasons why this didn't happen. And then, of course, some people just, after you got through the whole process and you determine they're eligible, they just don't, they don't participate in the study. So here's a the breakdown of looking at this. And what you can see here, right, is we start out consenting, fraction of the consenting is pretty much the same across the two studies. Obviously, sort of pretty amazing. We lose more from, and this is by design, really, right? We lose some people with respect to this eligibility, and that's happening in the RAISE sample. But even after that, right, we get, sort of a slightly lower participation rate in the those who are eligible and consented to be in this that actually completed the protocols in terms of doing the EMA for over the period of time and allowing us to use the tracking device on their phones, but not dramatically different, right? I mean, this is 83, 10 percentage point difference or 12, but not dramatically different. And the sample is, as I described, right, for reasons I described, sort of smaller for the GSMS sample.
Joe, can I ask a quick question? I mean, just clarification. So, but these were previous respondents. So these were respondents who have been participating in studies. I mean, they're not.
That's right.
Yeah.
They're part of an ongoing study.
They're part of an ongoing study. So that's, I suppose also an important.
Yes.
Right.
Absolutely. This is not a de novo.
Yeah.
This is not a de novo study where recruitment is to this study. Right, because they had neither study had done something quite like this.
Exactly.
In terms of the use
no,
of
that's good. That's good.
Their phones.
Yeah. Mm-hmm.
Okay, so, but yeah, here, but this now takes the same frame of looking at this, process, contacted, consented, et cetera, but does it now on an urban-rural plane, sort of divide. The top panel here is only for RAISE participants because, in fact, all of GSMS were rural by the classification. And here you can see, right, that if you do the comparison within the RAISE study, comparable, right, actually sort of consent rates are slightly higher in those who resided in rural areas versus those who resided in urban and suburban areas, non-rural areas, right? Their consenting is, sort of amongst those, the eligibility wasn't a particular problem. So, in the end, the total number of completes, right, we did lose some in the rural area. So basically 96% completed of those who consented actually completed in the RAISE survey versus 92%. But the point really is not much difference, right? And one of the key messages is kind of across a number of these things. I'll tell you some, even though without sides, I'll tell you some of the dimensions we looked at, but a common message is this is not dramatically different in the process of getting people involved in this study by rural and non-rural populations, right, for the comparable study. The bottom panel combines GSMS and two studies together, right? Again, you have to be careful about doing that pooling, but the same pattern really emerges, right, which is consenting isn't all that different, a little higher here in rural areas. GSMS sort of drives that. There's a bit of a drop off between people consenting and being eligible for the study, but between urban and rural, but not dramatically so. oops. Oh, I'm sorry. So here's just another view. We did a number, and the report sort of goes into more detail about sort of asking questions like, and looking at a number of different dimensions about participation and compliance, right? And here's partly about sort of the effort that was taken, how much contact was required to obtain consent from these individuals. And what you can see here again is I show you this. This is all for the race sample, because we can do the urban or rural, non-rural part of this comparison. You know, it takes a little bit more contact for the rural sample in this particular case. It takes, as a consequence, you know, there's a bit more you know, effort on the part of the field staff to be able to do this, but not dramatically different in terms of sort of the differences between the students. Again, another sign that this is not, you know, immeasurably harder. And again, remember, this is all done remotely. So none of this is contact by physical contact. This is all getting people on cell phones. And I don't know if you're, you know, you're like me. I mean, making contact, you can make it through emails as well. But if you're like me, right, I don't pick up all the cell phone calls that I get. And this is just another dimension of this kind of, you know, what did we find? Troubleshooting. Troubleshooting meant here, right, where we recorded that involved the field staff having to intervene in some way, contacting them, raising, you know, sort of answering their questions that they may have, trying to, you know, get them to participate in the study, that is to comply with the protocols of the study, were of these, you know, sort of this nature. And again, I'll take you to the bottom panel within the RAISE study. The differences between sort of the rural and non-rural parts of the sample, again, are not particularly great in terms of the incidence of the number of participants who had, you know, issues, right? This includes those who ultimately opted out, right? In terms of, you know, sort of are incomplete in the sense they just didn't finish the study. So our incentives we think got us a little ways, but they didn't completely close the gap of people who started the study and didn't participate. And you see that there's a little bit more contact, number of issues arising with the rural part of the sample than in the non-rural parts. But again, the experience seems to be that we were able to pull this off, and without having dramatically different sort of requirements for pulling this off in the same technology, same survey in these areas. I think it's this last one. This last slide sort of shows you where we day-to-day participation in this survey, right? This is the EMA part, right? So recall that this was 7 days, 3 times a day. So the maximum you could get was, you know, compliance in any given day was you completed 3 of these EMA studies, right? So you can see here across these patterns, right? We're getting about 2.5 completion, 2.5 of the EMA instances in a day completed, right? Which is pretty darn good. And you can see here the compliance rate as a fraction then, right? Did they comply on that particular day is pretty high in the mid-80s across this study. Again, I do this by non-rural and rural areas. And as you can see for the RAISE study, which is the same, as I said, same study, same part of this, right? There aren't big differences. If anything, there's a slightly higher rate of compliance amongst the rural population than the non-rural population. This study occurs, Sarah, remind me here, but right, we started in what? We started in April of this year?
Yeah, around then, yeah.
So this is a period in which, you know, we're still in the COVID pandemic, but so, you know, we kind of speculated about, was this going to be a bunch of people are staying at home a lot, and so they had time on their hands, and, you know, they could answer these questions, and we can't rule that out. We'd have to sort of, you know, repeat this study in a different time period, but nonetheless, we came away with this pretty heartened about, right, heartened about the fact that we could kind of, you know, sort of do this. The comparability, it was pretty much the same for the GSMS rural sample. As I said, it was a Native American population. So this, our take on this is, one can do this, and one can do this in rural areas. What I don't have for you today, I think this is the next slide. One last thing. This was just time of day, right? Yeah, sorry, I forgot this. Right, this was just compliance on time of day. So total possible out of the 7 days by morning, afternoon, and evening. Again, what you see in the bottom frame is that people, not only is there not a lot of distance in the completion, not a difference between urban and rural, there's not a lot of difference between the completion based on time of day, which is kind of surprising in terms of this. Again, maybe people had time on their hands. But you can see what we did here was, we wanted to get morning or afternoon, so we didn't want each of them bleed into the other one. So we put time limits on. If you didn't finish it in, as a slide indicates, in 90 minutes, we stopped the morning EMA. You could go on to the afternoon one, but you were declared as having missed the first one, and we didn't let them sort of keep accumulating up. So it wasn't you could ask at the end of the day, answer all three of the morning. We wanted this, it's supposed to be in the moment, and that's what, this is a standard protocol that we followed, but you can see that the result was it was pretty good compliance. What I'll now say, which I started to say before, is the amount of data that comes with tracking, right, is massive. This even is challenge. I mean, one of the challenges we've encountered is just downloading this stuff, right? In terms of being able to get this data, let alone being able to sort of analyze it. And until we do that, I can't give you sort of the comparable results about compliance, right? And how it varied by day, et cetera, and how the urban-rural split. We will get that reasonably soon and sort of provide it. We're going to go on and do the team is going to go on and do some analysis of this data, including Kate's earlier comment about the issue about what's the role of perceived reality. Interested in seeing Scott's study on this. In part, right, we are interested in this question about, can we track some of that down? And we're developing a set of hypotheses about sort of that type of analysis. So we don't have much to say, but I think our conclusions are on this slide. We feel pretty good about this. I mean, and again, it's being candid is the key. That we're not trying to advocate for people doing this, but we came away and think this is really feasible. And participation compliance were doable without extraordinary effort in a context in which we weren't doing this by knocking on their door. I've been involved in studies, Kate has, right, where you're using in-person interviewing, and it's costly and time consuming. And when somebody doesn't show up, it's really or they're not there or whatever. So the fact we could do this recruitment, right, and participation remotely was a really important part. The compliance rates were pretty darn high for this study, and there wasn't much difference across urban, rural. Some, but sort of not a lot. So bottom line is we're writing this up. We're not advocates for this, but we're suggesting that people can do this. We raised some serious questions, and there's a whole section of the report in which we talk about there were things that were difficult. The massive amount of data and just dealing with it was huge, right? The adaptability of the app that we were using, right, is an issue that one's going to have to confront because this app would do both the EMA and the tracking. Maybe you want to sort of, pull that apart. And this is an area of rapidly changing technology. So, tomorrow you could have a different set of devices to use in this analysis. And, we're not going to be in the business of rating all of them, but it was, I think we've learned a lot from this. And the last part of this is, as the slide indicates, is this was really an interesting, collaboration. We didn't start out as a team anticipating this project. It kind of fell into place in discussions from, between. I've known Rick for a while, but we never worked with him and gotten to know Sarah as a astounding staff member. Soon to be going to graduate school, I hear. So those places who are looking for somebody, don't. Yeah, I think you're going to be a lot of people are going to be interested in attracting you to their program. So this was really useful, and it was a good experience. Let me close with two more slides. Sorry, I keep doing that. we're serious about this matter of rapid dissemination of our results and this education plan influencing the next generation. And this just kind of lists some of the activities we're doing. And we're developing this. Kate alluded to this earlier. We had put together this focus group, some people from Duke, some people from UNC, some people from neither place, right? That we knew, to ask them, how do you where do you get new ideas from? And guess what? They aren't what I did. They aren't the way I would have gone about doing this. And our collaboration with Rick and Sarah has led us to even different, as a psychologist, how this whole registration of sites where you're registering studies and protocols that you're using in those studies. These are all things which we've learned, and we've got more to learn. And Francesca is sort of leading this effort of sort of figuring out how do we get to different audiences? Where's the way to sort of do this? I guess my naive view was, oh, you put this out on a website and hopefully somebody will find it, right? It doesn't work that way. And so we're trying to really figure out how do we influence studies, and I think that in a positive way. I mean, we're not trying to get them to adopt anything. We don't have any patents or licenses for any of this stuff. We're just hoping that people actually use it and come to us with sort of the findings to maybe reinforce or to say that these particular protocols aren't robust. So we're exploring that, and let me end then with the last slide, which is, I keep doing it. Suggestions are really welcome, and if we can, we can stop, and we got maybe a few minutes. I don't want to take too much of your time, but we're really interested in ideas, both in terms of areas of innovation that we haven't covered. We've laid out 3, right? Our goal is to do more than this, right? Those were the ones that we sort of initially came up with. We have funding to do more. It's a 5-year project, and we really would be interested in people's input. We've kind of laid out what we're looking for, but we really encourage people to get back to us and suggest things. Kate?
Yeah, I just wanted to say that one of the other things that has been so helpful about this process is to just be open to lots of different ways of thinking about the methodology. And I just wanted to give a quick example that I thought Joe had this brilliant idea of really rethinking how EMA is used. And for instance, why not use it to look at labor market participation and employ it over the course of a year rather than the course of a week? And I think I mentioned this briefly during my first half, but I think again, reimagining how some of these methods can be employed is just really helpful. And it's great to have such an engaged partner in all of these kinds of things. I've loved working with Joe on this, and it's been exciting to see where Core D has gone. I would say particularly during a period where you might think innovation in social surveys would be hampered given the pandemic, and actually we've been incredibly active. And so